Hello, my name is Lacey Stockstall, and I'm doing a presentation on a global health emergency from a viral illness that has affected our community. The stakeholder I chose was a local physician-owned hospital. Interviews were conducted with the director of nursing as well as current staff within the facility. Hospitals play a major role in responding to local emergencies and healthcare needs. There are many roles and responsibilities of the hospital, including delivering competent and effective patient care. Even with the current global health emergency taking place, hospitals still have to provide adequate care to not only the patients with the virus, but also to those with other healthcare needs, such as heart attacks, strokes, and injuries related to trauma. Another responsibility of the hospital is to provide resources and education. This includes not only keeping staff in the hospital educated on any current guidelines during the pandemic, but also keeping members of the community informed. Many members of the community rely on the hospital to keep them up to date on how to prevent the illness as well as how to manage symptoms effectively. Implementing effective policies and procedures is another responsibility of the hospital. It's essential that the hospital ensure that all staff are aware and educated on the current policies within the hospital and that there is also an emergency disaster plan in place. There are a lot of resources available within the hospital for not only ensuring that patients receive the care they need, but also to protect the patients and the staff and help prevent the spread of the virus. Some resources include ventilators, crash carts, medications, vaccines, blood products, proper PPE, IV supplies, supplemental oxygen, and having access to a wide range of medical staff. Infection control prevention. In the hospital, there's a lot of things we can do to help prevent the spread of infection, such as ensuring that staff are following isolation precautions, making sure that they're educated on its proper use, and making sure that all staff and visitors are wearing masks at all time within the facility. It's also beneficial for there to be adequate hand sanitizing stations located throughout the hospital, and to keep the patients who are currently diagnosed with the virus on a separate unit if possible. Unfortunately, during a pandemic, there may be several resource gaps that can have a negative effect on the hospital and the ability to give adequate care. One is the lack of medical equipment available as well as minimal space. The hospital that I interviewed only had 3 ventilators available within the facility, which limits the ability to provide care to multiple critical care patients at once. Fortunately, if available, the hospital could utilize ventilators from 2 other hospitals nearby. Space is also a big concern with this virus that's going on. There's just not enough open beds to care for those affected by the virus and for the other members of the community needing hospital care. One solution for this could be to postpone any elective procedures. Staffing's another major resource gap. With the number of cases rising, there's not enough staff to go around. Not only are staff expected to take on bigger patient loads, but also they're getting sick. This has made it really stressful for the employees within the hospital. Some possible solutions for this concern would be to utilize agency nursing if available, as well as providing larger incentives for current staff as well as new staff. And it's also important to make sure that all new staff are getting the training they need before being put on the floor. Infection control resources within the hospital. So vaccine education is really important within the hospital. It's important for us to encourage patients to receive the recommended vaccine for the virus, as well as for them to stay up to date on any other vaccinations that may be needed. Another resource is to utilize available PPE. It's important to follow all current guidelines related to the virus, such as wearing masks, using hand sanitizer frequently, and maintaining social distancing when able. Training and education from infectious disease staff can also be a really good resource to have within the hospital for us to turn to for any questions or concerns, and to keep the employees up to date and notified of any changes. Credible resources. Thankfully, there's a lot of credible resources available to healthcare workers as well as for the members of the community in regard to infection prevention and control. A few are the Centers for Disease Control and Prevention, the World Health Organization, your local state health department, as well as the Food and Drug Administration. These resources offer information on symptoms, treatment options, travel advisories, and any current recommendations or guidelines to follow. Priorities for the vulnerable population. The vulnerable population includes the elderly, children, pregnant women, and those with weakened immune systems or multiple comorbidities. Some priorities for this population would include prevention. It's imperative that we take all the precautions possible to limit possible exposure to those who are vulnerable by enforcing masks while inside the hospital, limiting visitors, and utilizing proper PPE. Another priority would be tools such as telehealth. By encouraging telehealth appointments for non-critical health concerns, the risk of exposure can be reduced. Early testing is also really important. By encouraging early testing, those who do test positive will be able to isolate themselves while contagious, which is essential for reducing the spread of the virus to others. Supporting our community. Ways that I, as an infection prevention and control nurse, can work with the hospital to support our community would be to first and foremost lead by example. It's important to practice what we preach. Make sure we're wearing our masks, using hand sanitizer, practicing social distancing, and following any other recommended guidelines that are being implemented within our hospital. Basically, we should be doing the exact same things that we do at work. We should be doing it at home and in public. Another way to support the community would be to organize drive-through testing sites. This can help limit the amount of people that are going in and out of our hospital, which is important for infection control. Education is another huge way to support the public, especially in a rural community. It's essential to keep everyone up to date with ways to prevent infection from the virus, as well as information on resources available for the public. Risks and benefits of collaboration. Collaborating with other stakeholders can be beneficial, as it allows for the combining of ideas as well as the utilization of facility resources and staff, which can be really helpful during a pandemic. A possible risk would include having disagreements in regards to current policies and procedures and not being on the same page as far as values within the healthcare facility. Potential impact. A global health emergency is a very stressful and overwhelming time. A few potential impacts that could occur would be the burden it places on one's mental health, not only for those at home living in fear of the virus, as well as the financial strain that it can put on a family, but for the healthcare workers who are burnt out from being overworked and for the amount of grief that they are a witness to. Are we ready for another pandemic? I don't think there is any way to truly be 100% ready for another pandemic. Right now, all of healthcare is still stretched so thin, and we need time to recover from the physical, mental, emotional toll the pandemic has placed on us all. To get ready, we need to acknowledge that this can and eventually will happen again. We need to make sure that we have learned from the mistakes we've made and recognize the importance of working together. We also need to make sure we have adequate supplies. and specific policies in place. It's also important to make sure that the members of the community know where to find any information in regard to a current pandemic. Ensuring adequate mental health services, making sure that they are easily accessible and affordable to all healthcare workers and members of the community.